All right, everyone, it's time to get ready for a national lockdown. You can sure smell it. It's coming. As well, I need to talk to you about how cases are exploding by a factor of 10 every 14 days. And then we're going to talk about what you can do during this next period of time, which will be a quarantine. Hello, everyone. This is Chris Martinson here with your SARS-CoV-2, a.k.a. the honey badger virus update for March 15th, 2020. And this is Sunday. It's about 12:30 in the afternoon. So my data is probably going to be just a little off if you're watching this in the evening. All right, so let's get going. First, as we look at these charts, we can clearly see the exponential nature of this. This is total cases outside of China. Here we are in a linear chart, so of course it has this shape like a hockey stick. But as we've learned, the gold standard for detecting if something is truly growing in a logarithmic or exponential fashion, or geometric, depending on what we're talking about, same words, more or less, for our purposes, where we're going from 1 to 10 to 100 to 1,000, 10,000, 100,000 to a million, is the gold standard is to see, do you have a flat line? So maybe there's one case there, and then there's a sort of a slightly different slope there, but those are straight lines more or less. And that tells us that we are experiencing exponential explosion in cases. And by the way, something we have to keep in mind is that this is with very poor levels of testing under the don't test, don't tell policy that a lot of countries, including the United States, many others, were actually running. So we're looking at another thing we can glean from that exponential or logarithmic chart is we can ask the question, well, how many days between it growing by a factor of 10? So here it grows from 10 to 100. And that took 7 days if we count those little dots. And then to go from 100 cases reported to 1,000, that took 19 days. But this is under the don't test, don't tell policy. I think this is inappropriate. We can see the slope of the line pick up a little. I think this is mostly due to testing at this point. This is a 13-day stretch to go from 1,000 to 10,000. And we haven't quite hit 100,000 external outside of China cases as of this recording because the 15th isn't noted on here, but I'm going to bet you anything. When it does, it's going to land right on that 100K line right there. So that would be 14 days. What does that mean? It means in 2 more weeks, in another 14 days, there's going to be 1 million cases worldwide. It means in a month, we're going to be at, which is 2 weeks after that, we're going to be at 10 million cases. Case, cluster, boom. This is the boom stage that we've been worried about. We've been talking about it. That's going to flood the hospital systems. It's why we are huge advocates of the flatten the curve movement, that we have to do everything we can, and everybody has a role in this. This isn't the authorities doing it one way and us doing it another. We're all in this together. All right. I keep telling you the China cases, they seem legit. I found this graph. Look at this. There they are going through their exponential. Oh, that's it. Good job. All numbers are accurate. Thank you. Have a nice day. That just is absolutely not legit. So I do think that China led the way and showed us that you do have to entertain a very, very stiff quarantine. What we don't have from China is any evidence to say that you can then relax that quarantine, let people out, and then all of a sudden you won't get a resumption in cases. So, but this chart just, I got to laugh at that. Totally not legit. Didn't happen exactly like that. A little bit of a concern because we do note that Malaysia had a big uptick in cases here for today. That was reported, or maybe that was yesterday. I'd have to look at the timestamp on that. But at any rate, cases, and this is south of Cambodia. Here's Singapore that's been controlling its cases very, very well. But Malaysia suddenly with a big uptick, and it's a concern because we're kind of hoping summer is going to take care of this. I presented evidence that showed that a certain combination of humidity and temperature seemed to prevent the spread of this thing. Well, I mean, look at this, 96. These temperatures are well outside the band that we thought maybe this would spread well in. Humidities are all right in the sweet spot. However, this is, I think this, if you remember the sweet spots, it was from 45 to 80% humidity. So at any rate, maybe it's the humidity more than the temperature, don't know. Or maybe these people are all working in air-conditioned buildings. And this stuff spreads very nicely in air-conditioned buildings, which creates a very nice condition for the honey badger to crawl through the pipes and get out there and infect people. More concerning than that, however, is that the Dutch experience so far is telling us that half the people, more than half, in intensive care units are under the age of 50. So not huge numbers yet, between 40 and 50 corona patients in critical condition. But more than half of those are under the age of 50 years. And there are also young people in there. So let's go on. I'm going to continue on in this particular article. Remember, all of these links are here, and I'm also going to be posting those below this so that you can just click on them and you don't have to get writer's cramp trying to track those. All right, half are in the ICU under 50. Here we go. First, continuing that article, a 16-year-old boy from Breda is infected with the coronavirus, currently in the intensive care unit of the Erasmus MC Sophia Children's Hospital. His family calls on the whole of the Netherlands, wake up and take this virus seriously. Okay, so a 16-year-old boy in the ICU, that is not a good sign. So it can happen. Of course, we know the statistics are low. It looked like it was a 0.2% death factor for people in this age bracket. That's 1 in 500. Maybe this boy was just one of those unlucky few in that 1 in 500. But this statistic says that something is different and off, and we're going to be adjusting these as we go forward. That's not a good sign to see that many quote-unquote young people in the ICU. Dutch doctors have also been informed about patients from Lombardy, Italy, excuse me, who confirmed data that young and relatively healthy people are also affected by the coronavirus. Okay, and I'm going to be telling you why that's really important in a minute. The youngest intubated COVID-19 patient, honey badger virus patient, is a girl of 16 years old. And 2 children, I don't know what that means in terms of age, were admitted to the pediatric IC for observation, but did not require additional therapy. So confirming, of course, that kids, the younger they are, the better they are, for whatever sets of reasons. The first patient in that Italian region to receive a ventilator was ventilated for 18 days. While he was relatively healthy, it was a 38-year-old, otherwise very healthy man who ran marathons for this. Okay, so it does hit younger people. Continuing in this article, a little lower down, this is the part that I think jumped out the most for me, even more than young people are also affected, is that the main risk factor was obesity. Okay, the main risk factor for intensive care uptake is obesity. So don't know why that is, but certainly that comorbidity is actually the number one thing that's presenting at this point in time. So remember, we've got to flatten the curve. We really want to avoid ending up in this zone up here, saturating our healthcare system beyond its capacity so that it begins to break down. This is how we do that right here. We join this movement. And now I'm going to take you to some really, really fascinating, very, very well done animations that came to us out of the Washington Post. Here's the link for that. And what I want to do here is just run these a couple times. These are great. These explain a couple of things. So let's just kick this one off and get it going. So what we're doing here is tracking those little balls as they bounce into each other. They're just infecting other little balls. And so you can watch that chart at the top. And what we're seeing is the total amount of cases. Eventually people recover. So you set a recovery time on this. Those are the people who are in pink now wandering around. And this is what you should see over time, is that sort of a shape as a disease runs through, and then eventually that would be full herd immunity because every single ball is pink in this particular case. Let's run that one more time so we can just see this. There's 4 separate simulations like this, and they're just, I think, get the point across very, very well. So this is a completely unrestricted society. Everybody's moving around. Nobody has any clue about this disease. They're coughing in public. They're not wearing masks. They're all bunched up in big sort of groups. They're going out to bars, and you will see that sort of a shape. Now, how would you go about maybe controlling this? So one thing is you can actually put a border in. So here's a second simulation which has a border. That's this line right here, and the border now opens. And we let a few flights through. We can't stop travel. We got to keep the airlines coming through. So what happens when we just even allow a few people to come through into our society? This is why we say you have to seal the borders as much as you possibly can, because as soon as you allow the infection in, boom, you are going to get it completely. And what was interesting about this, let's run that one more time, is just how quickly this does spread. So here it is in country A. We're just going to allow one flight in. We're just going to let this flight. We're going to let a flight in, and here comes a flight, and that's it. With something that spreads this easily, all you need to do is just let even 1 or 2 passengers in, and you're dealing with it. All right, let's talk about doing it right. Based on that data, New Zealand, the Doing It Right edition. This comes from Greyman, posting it to Peak Prosperity. This just got posted last night, I believe. New Zealand tightens the border controls to flatten the curve. Yes. And so let's look at this. Effective from midnight Sunday, that's today, all travelers, except those coming from the Pacific Islands, all right, which I believe don't have any cases recorded right now, will have to self-isolate for 14 days on their arrival to New Zealand. Look at this. All travelers, not foreign travelers, not people of any particular country, region, ethnicity, anything like that. All travelers, including New Zealanders, has to self-isolate 14 days. These are the toughest rules in the world, according to the PM. I believe that might be the case. She told New Zealanders not to travel overseas if they don't have to, and issued stark advice. No hugs, hongi, or handshakes. All right? All cruise ships have been asked not to come to New Zealand until June 30th. There will be no further announcements on mass gatherings, and strict new border exit measures for people traveling to the Pacific have also been put in place. People who have traveled outside of New Zealand the past 14 days are not permitted to travel to the Pacific Islands. Note, so if the Pacific Islands don't have this stuff, then let's keep it that way. So they're in full isolation right now, so don't do it. No travel to the Pacific for close or casual contacts of a confirmed case. No travel for anyone who's symptomatic. Of course, that makes sense. Health assessment, including temperature checks, will be done. And restrictions prevent foreign nationals traveling from or transiting through mainland China or Iran from entering New Zealand. Not sure why that doesn't also call out Spain, France, Germany, Italy, most of Europe, actually. The government has also issued a stern warning for people with health conditions to reconsider overseas cruises. I'll go further than that. If you're thinking about going on a cruise, you are nuts. You could not pay me to go on a cruise. I don't care if I was losing money because I had one booked. I'm not going on a cruise. Now let's talk about how we can flatten the curve. Let's talk about lockdowns now. So this is why I think you need to be ready for a national lockdown if your country doesn't already have one, because it is the only thing that works. You can stay the F home yourself, but I think governments have to step in and do the lockdowns. And let's run a simulation that shows a lockdown. This is with 25% of the dots are now stationary. 25% of the dots are people that aren't moving. Or maybe this is 50%. But at any rate, look how much more slowly this is all spreading when we don't have everybody moving around and going to gatherings and bumping into each other and coughing on each other in lines and all of that. So you can see the shape of that curve up top as it's being drawn is a very, very different shape. Everything's still moving the same speed. We haven't slowed the dots down or anything like that. It's just very, very effective. So that's what a lockdown will do for you. But now let's look at it with only 1 in 8 of the dots are going to be moving now. This is what a lockdown looks like with 1 in 8 moving. So pretty complete lockdown. The other one was 1 in 4 moving, I believe. All right, look at the shape of that curve being drawn up top. It's still gonna spread. Over time, you give this enough time, every dot's going to get to pink eventually. But look at the shape of that curve. So if only 1 in 8 are moving about, this is what happens. All right. So this is a great visual to explain. I'm just going to run that one again because this is what I want to see happen. This visualizes, I think, very, very well why and how a lockdown actually works. And in this case, I think the only thing you could maybe criticize is that anytime a dot bumps into a dot, it instantly changes it. Does this coronavirus instantly infect with 100% accuracy? No, but this visually really demonstrates the difference, I think, between unrestrained movement and a complete lockdown where only 1 in 8 are moving around like that. All right, I also have a very important piece of information for you. This informs my own strategy around how I'm going to self-isolate, why I'm going to wear a face mask, even though it's socially uncomfortable still in the United States. I still get these dirty looks from people like I'm harshing their buzz, but I'm going to wear one. And here's why. This was a really great piece that comes out of Rishi Desai. He's chief medical officer and former outbreak investigator at the Center for Disease Control. And so here was one little piece. He talked about what's called a low inoculum. So if you're in a lab and you're going to inoculate a plate of medium in a petri dish and you're going to grow yeast or bacteria on that plate, the inoculant it uses is you dip a little wire loop into a culture, a liquid culture that has a bunch of whatever you want to inoculate, a bunch of bacteria in it, and then you swipe that across the plate, and that's called inoculating the plate. So he's talking about how the inoculum is how many of those virus particles you would get in your own body. So let's listen in here.
Where there is an interesting wrinkle, kind of want to focus your attention on, is where you get a big inoculum. Right? So when I say inoculum, what I mean is lots and lots of secretions full of virus versus a little bit of a secretion full of just a little bit of virus. So let's say two scenarios. One, I'm trying to intubate, putting a tube down someone's throat so that I can help them breathe, and I'm right in their face, and let's say I'm not wearing my N95 mask because it's soiled or I forgot to put it on or I'm in a rush, and I'm kind of face to face, and that person just kind of coughs or sneezes or gags, and all of a sudden I get in my face kind of a shower of these particles full of virus. That's a large inoculum. Compare that to me being at a conference and me grabbing a handle on a restroom, and maybe someone had forgotten to fully wash their hands and they got some virus on that handle. That's a small inoculum. So these are the two different inoculums. What we know from the data is that when you get a large inoculum, you get sicker. And so the people at risk, I mentioned the elderly, but the other group at risk for serious disease are healthcare workers, because they're with the sickest patients, and the sickest patients tend to have the highest amounts of virus. So that's just one thing to kind of keep in mind.
All right, really important information in there, and it's that when you get a larger inoculum, you tend to get sicker. So I want to talk about this because this informs why I wear a face mask and how and why hand washing works the way it does. So I want to talk to you about viral loading very quickly. So what he's talking about in that video is that when you get a really large dose, like you have a large starting dose of the virus, then you have trillions of virus particles enter your body all at once. And then so they're starting from a very high level, and they start from there and take off like crazy from there. So I couldn't find a lot of information about this, so I'm only going to be able to give you representative numbers. But I thought two things. First, notice here with SARS patients, right, we're looking at a case here in Transfusion Medical Medicine Reviews from the 21st of February of 2020. So these people report that within 3 days after fever onset for SARS, again, this could be different here for the honey badger virus, just a little different. 19 out of 24 of patients had detectable SARS-CoV RNA in plasma, so that's in the blood. The viral load level rose fast, and the maximal viral load was around day 4 or day 5 after the onset of fever, after which the viral load quickly decreased. So this is almost certainly true that we're going to see that if you tracked your viral load in your body, let's say right here is where you get first exposed, and then it goes up, and you're going to have a lot of them, and then it's going to come down again like this. And it might be that up to here, you're asymptomatic, so you are capable of getting, infecting people with this, and we'll cover more of that data in just a second. But honestly, the amount of infectiveness you have here is not nearly as great as it would be here. And so what they're saying here is, at least for SARS, we see that the maximal viral load is around day 4 or day 5. So if we said, this is the onset of symptoms, day 4 or day 5, let's call this day 5 out here, right, is where you're going to have your maximum viral load, and then they're gonna go down after that, okay? And again, at some point you'll have sort of, let's say, minimal infectivity at some level where you've got it, it's detectable, but you're not really infectious, not compared to when you're just shedding them up here at the height, at the worst of it, all right? Their findings showed viral shedding in plasma, so that's into the blood, was common when people were clinically ill with SARS virus, and that plasma may be a better sample compared with nasal and throat swabs. That's probably almost always true. So looking at all of that, we don't know how fast this viral load is actually replicating in the body. I'm sure somebody does. I couldn't find out that data, which I wanted to answer this question, which is how many hours does it take for this virus, once it's in your body, to double and double and double again. So I don't have that data, so I'm going to show you something representative that's going to begin to explain this idea of why starting with a low inoculum level would have a better outcome for you, and that if you get hit with a really high inoculum level, that is a big fat blob of trillions of virus particles, why that is associated with more serious cases. All right, so I just made a quick little table here, and this is representative only, okay? I don't need anybody coming back saying this is inaccurate, because I know it's inaccurate because I just made it up, but because I don't have good data. So let's just look through here, and this is the viral load you might have. And let's imagine, and this is totally imaginary, that it has a 4-hour doubling time. So if we got one virus particle in us, honestly, it probably wouldn't even make you sick, because there's some minimum threshold you need to get exposed to that would lead to illness. Anything less than that, and it's probably going to be unsuccessful. Why? Because maybe that one virus got in you, but it didn't travel in your body anywhere where it could possibly latch onto an ACE2 receptor before it got deactivated, by proteases in your bloodstream or whatever. But let's imagine that if it was able to replicate after 4 hours, there would be 2 of them, because it doubled every 4 hours. And after 8 hours, now there's 4 of them. And after 12 hours, there's 8 of them. And after 16 hours, there's 8 of them. And after 20 hours, you got 16 of these, and so on. See how this is just doubling like that? Double, double, double. So if you start with a low inoculum, and let's imagine, this was, you got some virus particles off of a doorknob. Well, before this thing's exploded, and I'm just making stuff up here, but let's imagine that this is the number where you suddenly are symptomatic and having that's where your fever first starts, okay? And I know these numbers are way off, but it's just representative. Look how much time you would have. You would have basically 2 or 3 days for your body to begin to mount a defense, recognize this invader, get your T cells all sort of spooled up. Your white blood cells are busy going there. They're identifying it. They're replicating. They're starting to make antibodies. They're mounting a defense. Your body has 3 days to do that, whereas if somebody goes ahead and just coughs into your face, maybe you're a well-meaning child who just picked it up at school, because kids like to cough in their parents' mouths for some unknown reason, and you start with this load, you only have 4 hours before you've gotten to a symptomatic load. Your body hasn't had time to adjust to this, and it's off to the races. These numbers are just exploding after that. So with a low inoculum, you have time for your body to adjust to it. So if we're all going to get this because, accidentally, no matter how careful we are, someday there's a particle drifting on the wind, or somebody coughed somewhere, way up in the front of the plane, and somehow we caught it. If you can start with a low level of a viral load, you give your body time to begin mounting that defense before your body gets overwhelmed. Okay. So that's my interpretation of that. And so, of course, the conclusion is wear a mask. Wear eye protection, wash your hands, right? That's why we do these things. I don't care what anybody in the government says. Masks help. Are they perfect? No. But if the mask catches most of it and a little sneaks around the edge, and I get that, I'd much rather have that than just getting the whole blob because some idiot in the government said masks don't help because they forgot to order them, and they don't want to say that because they're personally and professionally embarrassed, because that is embarrassing, professionally and personally. All right, which brings us to this. So I found this morning. William Culp says, I'm a bartender in New York City and watched the bar fill up today with people who are talking 2 inches apart. So they are basically coughing into each other's faces at this point in time, yelling in a bar. Young people don't care and aren't listening. Staff are at risk. I'm uncomfortable working. William, if I were you, I wouldn't go into work anymore because I wouldn't want to get that. I wouldn't want to get a massive starting viral load in all of this. And by the way, to all those young people who feel this is a boomer disease, it's hitting the elderly, I'm not old. You just need to get up on the data here, because this could hit you. And when it does hit you, remember, we talked about this yesterday. If it does and you recover, which you might because you're young, you still might recover with permanent and serious lung damage. As well, the young pretender writes in, replying here, says, I received this email from a friend a few minutes ago in the UK. I just spoke to him. He says students are in denial. Everybody is partying as normal. Restaurants and bars are full. Well, probably in no small measure because the UK leadership has been absolutely abysmal in relaying the concern around all of this. They've done a terrible job. Summer writes, I'm full on practicing social distancing and I look out my window a few times every night. Restaurants and bars on my block still packed like sardines. Everything seems so normal. Not good, right? That's because people don't understand the basic data, the basic science behind all of this. They don't understand what the risk they're taking by potentially starting with a large inoculum rather than a small inoculum, so they're out there in crowded bars. So if you want to talk about creating inoculum chambers, here's one. They just created one at O'Hare Airport. This is my personal nightmare right here. Ben Hunt writes, complete disarray. That's kind, Ben. Brooke Geiger McDonald said, this is the scene at O'Hare Airport. The traveler who took the photo said it's a 6-hour wait for bags, then on to customs for 2 to more of waiting in shoulder-to-shoulder crowds. Police are handing out water and disinfectant wipes. Oh my God, I'm not sure the wipes are going to do any good. But you know what I do? I grew up playing Where's Waldo, so I look through all of these pictures carefully, and I'm asking, who's wearing a mask? And I usually can't find a single person in pictures like this. So that's all I would need to do is be standing right about there and hear somebody cough over here, and I would just crowd surf my way out of there. It'd be like just running on water. Get out of there. This is an inoculum. This is the street edition, so we're inoculating the streets. Guess what? No, you can't put off St. Paddy's Day. Certainly not. Revelers in the Irish Channel celebrated St. Paddy's Day in New Orleans Saturday, March 14th, in gatherings large and small, amid an outbreak. Any masks? Nope. They got magic alcohol. That's going to protect them right there. Magic alcohol. All right, doing it wrong, the U.S. edition. Kaiser Permanente. This was from Saturday. Broad Spectrum at Peak Prosperity, writing in, member there. Says, hello all, I live in Southern California, LA County. Here's a paragraph from the email that Kaiser sent out to its members. If you're healthy, you don't need a mask. The CDC doesn't currently recommend the use of masks for most people. Only people who are sick with COVID-19, the honey badger virus, and the people who are caring for them should wear face masks. We'll provide masks to members and patients who have symptoms when they come to our facilities. One of their pieces of the advice on staying healthy, they had 7 bullet points. One of them, stay home when you're sick. That's it. That's the advice. Thanks. That's awesome advice. So this is really botched advice. And even in CNN, so this is CNN, March 14th, they're getting it right. Finally, we were presented this data weeks and weeks ago that there is this thing called asymptomatic transmission. I'm just curious how so much and so many health authorities can be behind the curve on this one, but they are. So check this out. New studies in several countries and a large coronavirus outbreak in Massachusetts, which is my home state. I'm recording this in Massachusetts, so this is personal. Bring into question reassuring assertions by U.S. officials about the way the novel virus spreads. These officials have emphasized that the virus is spread mainly by people who are already showing symptoms, such as fever, cough, or difficulty breathing. Mainly. Who cares about mainly? Remember that simulation where you just open the border a tiny bit and you just let that one infection come through, right? So mainly is not good enough in this story, not with this virus. If that's true, it's good news, since people who are obviously ill can be identified and isolated, making it easier to control an outbreak. That was SARS. We've known for over 50 days that this isn't the case. We've known for a long time that it's not just the people who are obviously ill that you have to track. We've known about asymptomatic transmission, but it's just finally making it into the national and international consciousness, but not for Kaiser Permanente. They didn't get that memo yet. So listen up, Kaiser people. Okay, but it appears that a Massachusetts coronavirus cluster with at least 82 cases was started by people who are not yet showing symptoms, and more than half a dozen studies have shown that people without symptoms are causing substantial amounts of infection. More than half a dozen studies. Not a single study showing that they aren't causing anything, but substantial amounts of infection. Let's read that again. More than half a dozen studies have shown that people without symptoms are causing substantial amounts of infection. Half a dozen. And we presented one of those many, many weeks ago. So I don't even know how a big organization with billions and billions of dollars that scrapes, massive healthcare premiums and has huge staffs couldn't find one of those studies and work that into their communications here, because this is complete junk. Absolute garbage. All right. For weeks, federal officials have emphasized that asymptomatic transmission can happen, but have said that it's not a significant factor in the spread of the virus. On March 1st, on ABC's This Week, U.S. Secretary of Health and Human Services Alex Azar told host George Stephanopoulos that asymptomatic spread is not the major driver of the spread of the new coronavirus. Well, again, even if it's a minor driver, isn't that important? So continuing this particular article here, in an article 2 weeks ago in the New England Journal of Medicine, Bill Gates expressed concern about the spread of the disease by people who haven't yet developed symptoms, only a bit sick, writing, there is also strong evidence that it can be transmitted by people who are just mildly ill or even pre-symptomatic, which is another way of saying asymptomatic. This will mean it'll be much harder to contain than MERS or SARS. Of course, we've known that for weeks. All right. On Tuesday, Dr. Sandra Klesik, director of the Institute of Medical Virology in Frankfurt, Germany, tested 24 passengers who had just flown in from Israel. 7 of the 24 passengers tested positive for coronavirus. 4 of those had no symptoms. And Klesik was surprised to find that the viral load of the specimens from the asymptomatic patients was higher than the viral load of the specimens from the 3 patients who did have the symptoms. All right. Their viral load was higher. And these were the asymptomatic people, okay? So as soon as you get data like this, we're all done. Boom. You have to move fast in a situation like this. We are all done. There is nothing more to be said. We don't have to gather any more data. We are now operating on a new frame of reference, which is that people with viral loads who are asymptomatic are a thing, okay? All right. And, you know, of course, I can't even tell you how disappointing it is to see people who should be well informed being that poorly informed. And so speaking about the need for speed in a case like this, let's turn now to this. This is actually, it's a WHO executive director, Dr. Michael Ryan. I told you there are good people working in the WHO. This is one of them. Let's listen in now to Dr. Michael Ryan talk about what you need to do in a disease like this.
What we've learned in Ebola outbreaks is you need to react quickly. You need to go after the virus. You need to stop the chains of transmission. You need to engage with communities very deeply. Community acceptance is hugely important. You need to be coordinated. You need to be coherent. You need to look at the other sectoral impacts, the schools and security and economic. So it's essentially many of those same lessons, but the lessons I've learned after so many Ebola outbreaks in my career are be fast, have no regrets. You must be the first mover. The virus will always get you if you don't move quickly. And you need to be prepared. And I say this, one of the great things in emergency response, and anyone who's involved in emergency response will know this, if you need to be right before you move, you will never win. Perfection is the enemy of the good when it comes to emergency management. Speed trumps perfection. And the problem in society we have at the moment is everyone is afraid of making a mistake. Everyone is afraid of the consequence of error. But the greatest error is not to move. The greatest error is to be paralyzed by the fear of failure. And I think that's the single biggest lesson I've learned in Ebola responses in the past.
Yeah, if you need to be right before you move, you will never win. It's the single greatest error that we see. And so that paralysis is really important. So to the gold standard pandemic approach, I now have to add some information. I said here, clear, consistent, transparent, frequent, and timely communication, very important, but you have to move rapidly and without perfect information. That's why I've been bringing you this sort of information, and that's why we've been so far ahead of the authorities and all this stuff, because I didn't need to see 4 studies showing that there was asymptomatic transmission. I just need to see 1, and I'm going to operate on the presumptive principle that's true, and if it wasn't right, I would come back and I would correct that, of course. All right, and the reason we have to take this so seriously is, of course, case, cluster, cluster, boom. That last exponential part catches people by surprise, and the exponential analogy I used with the stadium and the drop of water and all of that says that the first 45 minutes, you're like, it's not so bad. People are still in bars. They're coughing in each other's faces. Everything's fine. And then the last 5 minutes, it's all over, right? It's just so fast. It catches everybody by surprise. But we should know that, and our health authorities should know that. And of course, they do know that. And this guy completely is aware of that. So when we look at things like this was a recording, really interesting if you want to listen to it. This is a transcription of the recording from a doctor inside of Italy, This is pulled from the middle of that transcription. I just wanted to share a few pieces with you. So here he says, you have no idea, they don't say this on TV, of how many young people, I mean even 20 years old, need CPAP, which is respiratory support, and have horrible pneumonias with no comorbidities, right? These are healthy people. They're not fat. They're not heart disease patients. They don't have cancer, nothing, no comorbidities, right? How many 70s born have pneumonias? 70s born, born in the 70s, right? So talking about their age here. Have pneumonias, a ton. It's unimaginable. Doctors there aren't even any devices even quarantined or screened with a test anymore. They tell you, if you had a contact but have no symptoms, come at work. If you have symptoms, you get the decision to work or stay home. Wow. It's tragic. Now they're hiring all non-specialized med graduates from Policlinico, for example, Policlinico. That's where my girlfriend is. We absolutely need people to understand this. Here's where we are in this story. The U.S. is roughly 10 days behind Italy. This is where the national lockdown went on for Italy. If the United States is smart, this is where the national lockdown would go in, somewhere in here. We can see California is even further behind than that, but we can see the remorseless, relentless case progression of all of this. There is guaranteed, full stop, a national quarantine coming for the United States. In fact, it's coming for every place where this thing is spreading like this. And that's pretty much guaranteed. Remember, one of the reasons we're concerned is even if you are recovered, maybe you're recovered with air quotes around that word or quotes around that word, because actually you may have a semi-permanent or maybe even permanent lung function impairment, and that would be a very bad thing. So remember, we talked about all these ways to avoid becoming infected in the first place. I'm going to put a new thing at the top here, which is undertake extreme social distancing measures immediately. You don't want to be one of those 1 in 8 people who's moving about. If you can begin to self-isolate, self-quarantine, not go anywhere, not have contact with people, just do that. Just do that right now. If you have to go out, you're going to be wearing, of course, mask. And if you're going to be in close contact, you need the eye protection as well. So if you can stay 6 feet away from people, cool. That's the way to do this. All right. So, okay, given all that, now what? I know quarantine's coming. All right, what do we do? All right, first thing, you got to self-isolate now. Just don't let that guy in, okay? Just don't do that. The second thing is you want to make sure your house is a clean zone, a green zone. So that means that you're not letting people into your home. And this is going to be tough. I totally get it, and I'll cover some of that a little bit more in just a second. But you want to make sure that your home is a place where you are safe, and that's at least for peace of mind, as well as that just makes a lot of sense. This is a well-managed gathering. That's what gatherings are going to look like for probably the next few months here. And if you have to gather, make sure it looks like that. That's how it's done. And you want to stay at least 6 feet away from everybody when out and about. So this panic shopping that's going on right now, let me see. Where's Waldo? Mask? Nope. Zero masks. These people are actually in order to prepare for something in a panic, because they weren't listening here 50 days ago. They're now stuck in this very untenable situation. But if you are going to get stuck in that situation, my goodness, you should be wearing a mask of some sort. And look at this case. This woman is wearing a mask. This woman's busy wiping her nose right here. I don't know what happens next after that. Maybe she picks up something off the aisle. I don't know. And you really just need to be staying like this. This is okay. That's better spacing right there. But the rest of this just looks like a thing I'd much, much rather avoid. All right. So what does extreme social isolation and distancing look like? It means there's no more school. When we get in this national quarantine, this will all be enforced, but you shouldn't have to wait. There's no more going to restaurants. There's no more going to bars. No more concerts. No more sporting events. Mass transit. Nope. Airplane trips. Nope. Cruises. I mean, do I really have to talk about cruises? I just heard about somebody who got on a cruise ship yesterday. I'm shocked. Especially no playing bridge. I'm talking to you, Mom, now. Poker, other games where items are passed around like cards, chips, other things where you're physically handing things around. Lots of studies show that this is one of the best ways to infect and be infected, is to hand things back and forth to people. And no more having friends over. and no more stopping by a friend's house. These are all really disruptive, draconian things, but this is what has to happen right away. So you're at home and you're not seeing a lot of friends anymore. Of course, we've got Skype and FaceTime and other things now, which really make that a lot less of a challenge than it was even, I think, 10 years ago. But so what do? Plant a garden. This was the garden I had at my old house. I'm going to have one that looks a lot like that. This spring, I'm putting it in my new place. This is on a 50 by 70 plot, so that's a tiny fraction of an acre. You can get a lot done. I had grapevines there. Yes, plant a garden. This is something I would absolutely do with your kids. If you've got kids at home, plant that garden. You want to see how much food you can produce in the shortest amount of time possible. We'll be talking about this in a lot greater detail because I see I'm already running long on this one. But we're going to cover this in a lot more detail because I think now we're past the whole idea that, the Paul Revere Act is over. I don't really have to go out and warn people all that much, although surprisingly, you still have to warn some people. They don't get it. It's still the flu. It's just the flu. No, it's not. That's still happening. But at any rate, the question now becomes, what are you going to do with your time? And how are you going to use it? And how are you going to use it wisely? And instead of just defaulting into, video games and Netflix and all that other stuff, it's time to let's use it wisely. This could be a real gift, I think, as well for a lot of people. We could learn a new language. We could hone a skill and do lots of projects. We could clean and organize our homes and get into that much lower level of clutter. And those are all things that are really important to do as well. So these are endorsed personal actions. We still stick by our endorsed national actions here. We think every one of these still makes sense. We could add more to that if we wanted to. Remember, this isn't the flu. It really isn't. It's not SARS. Shame on anybody who's still trying to claim it's, the flu is more deadly and all that stuff. The way this goes is case, cluster, boom. And we are almost at that boom stage. So my conclusions for today. When or if you do get the novel coronavirus, you want as small a starting viral load as possible. That gives you the best chance of not becoming one of those serious cases because you give your body the time it needs to begin to mount an effective defense. The boom, that's going to come at a surprising speed. That boom stage always comes at a surprising speed. That's just how it is. Welcome to exponential growth. As of now, we are expecting a continued 10x growth in cases every 14 days. So that takes us from 100,000 to 1 million to 10 million to 100 million. That's what we mean by that. And that's just covering the next 6 weeks in this particular story. Okay. As well, things that are exponential that just surprises us. Like if you're on ice and you're walking carefully and it's maybe that super slippery ice with just a little layer of snow on top, and it's just like extra slippery, that's coming. But if you slip on it, it's still going to be a surprisingly painful fall when it comes. Why? Because gravity operates exponentially, right? It's, it's a squared function. You are accelerating towards the ground. So you're moving towards the ground exponentially faster. It's just very hard for our human brains to understand exponential growth and exponential functions, even though we're pulled to the earth by an exponential function every single day. So you'd think we'd wire it up, but nope. Hey, even the under 50 crowd are getting slammed by this virus. We hope it doesn't represent a mutation of any sort that's come along to make it more virulent for younger people. But this whole idea that it just hits old people is not true. So let's make sure we combat that misinformation as well. Hey, lockdowns work. They really do. So expect one to come much sooner than you might think. Remember, things happen a lot faster than you might think with exponential functions. I'll be surprised if the United States doesn't go into a national quarantine or lockdown sometime this next week, maybe as early as Monday, this being recorded on Sunday, of course. Each of us, though, has a vital role in this. This isn't about what the authorities are doing. We all are responsible for flattening the curve. That begins with you. You're going to have to take your you're going to have to figure out how to do your own social isolation and distancing. You're going to have to learn how to be one of the first people to wear a mask, to not do handshakes, to break the social customs that are in place that are actually the ones that are getting us all infected. So that's up to each of us to do. But you, because you happen to be an early and fast adjuster. So that's up to all of us, but especially the people listening to this. It didn't have to be this way. It really didn't. We had all this information 50 days ago and more. So here we are. We're going to make the best of it. And let's all pull together and do the best we can, because this is actually going to call us all to greatness. It's an extraordinary opportunity. Life has changed. Yesterday is gone. There's a whole new tomorrow coming, and it's up to us to decide who we're going to be, how we're going to be, and what we're going to do with our time. So with that, I'm Chris Martenson. I will talk to you next time. Be well, be safe, everyone. Goodbye.
Hi folks, Adam Taggart here. Chris Martenson and I are the co-founders of Peak Prosperity. If you want to get alerted whenever we release a new video from Chris, just click the red subscribe button right beneath the YouTube video player. Once you've done that, a little bell icon will appear right next to it. Click on that bell. It looks like this. And that's it. The next time we publish a video from Chris, you'll immediately receive a notification from YouTube. Thanks for watching our videos.